We addressed 4 areas in our conversations with these experts today. The first area was contextual. We sought to identify the appropriate language to use. And of interest, each of our presenters used the opportunity to discuss language, whether we should call this substance use or substance abuse or epidemic or something perhaps more negative. Each of them in their own way answered the question about language by thinking carefully about the nature of the patient, the nature of the person. And in their own ways, they used the language question to broaden the topic to how you consider a person who is battling an issue, battling a disease, battling a condition, striving to deal with something that's causing them to use and abuse opioids. Each of them brought that out around the topic of language. And I thought that was both surprising and valuable to think through how they regard the use of language in a way that is empathetic, that is supportive, that is compassionate, and that really addresses the person not just as a patient, but as a person who's dealing with other issues.
There are certain characteristics that can help you to identify someone. One, I do think, is age. I think individuals, especially young adults, that have, as we know, a developing brain and are more prone to impulsive related activities, or it might be more of a social norm to use substances and try and experiment with various substances, I would always note as vulnerable to misusing a substance and kind of lead with that assumption.